round him up somewhere. But in the meantime, we'll go straight to Cressida. And she's going to talk about partly the project that the Centre for Policy Development has been doing, which is a really important project that I mentioned, establishing a context for Australia and how we learn from experience in other countries. Now, a little bit about Cressida. She's pretty unusual, I think, in terms of the people who normally get involved in this field. She's a philosopher and a policy advisor and has a strong line in, I guess, ethics, is an ethical advisor in the Crown Lana program, which is a Melbourne-based program. And she learnt her philosophy at two rather important places, Cambridge University and the City University of New York. And Cressida heads the project that I mentioned, and I can say from personal observation, it's been a pretty terrific job. It's managed to open up contact between many people in different sectors of government who probably wouldn't have talked to each other, and I think that's going to be one of its abiding benefits. So I'll pass over to Cressida.
Thank you so much, Mike. All right. Luckily, some of the things I was going to say have already been covered in the wonderful talks this morning, which means that I might just get down to the amount of time that I'm supposed to be speaking. Excellent. So as Mike said, quite a bit of what I'm talking about today is going to be based on a report that I and my colleagues at the Centre for Policy Development released in August of this year. So this report, Redefining Progress, Global Lessons for an Australian Approach to Wellbeing, was written by myself, Akwasi Ampofo, Francis Kitt, Toby Phillips, and Warwick Smith. And we looked at kind of 50 years of practice across 21 different countries, states, and municipalities. I'm going to be talking at national level today because we particularly focused on countries internationally, but there are lessons from other jurisdictions. And as has already been kind of come up numerous times, one of the things that's amazing is just how widespread this is. So, deep integration of wellbeing frameworks, okay, maybe not, but a commitment to wellbeing frameworks, at least wellbeing measurement. It's not just the number of countries or jurisdictions that are actually adopting wellbeing approaches, but also that, this includes rich countries, it includes poor countries, it includes conservative countries, it includes, conservative governments, liberal governments. This isn't a partisan approach. This doesn't seem to be defined by any particular existing economic system or even political system. And I think one of the reasons why we're really seeing this move is both because there's a recognition of a need to do things differently, but also a recognition of the real value if you get these kinds of approaches right. And in part, what I'm going to be talking about today is what kinds of things you need to get it right. We started off this project thinking that it was going to be kind of an analysis of best practice. Very quickly, we realized it's an analysis more of emerging practice. So some of these approaches have been around for some time, but often very few. Or, you have, in the case of somewhere like Ecuador, where you had a strong wellbeing approach that was actually written into the constitution, and then you have a change of government and it's not really being acted upon anymore. So you've got a little bit of instability there. You've also got, shorter term approaches for tackling issues that need a long run up. So we shouldn't, these new approaches, we shouldn't judge them too quickly or too harshly, because it's going to take decades rather than years to see whether or not these wellbeing approaches are actually going to lead to the kinds of change that brings about the outcomes that we all want to see. Look, you know what? That's been covered. Done. All right. What defines a wellbeing framework or approach? So wellbeing framework, the term has been used today, particularly to talk about wellbeing measure models. I'm going to use it a little bit more broadly, but maybe I'll move into talking about wellbeing approaches. And obviously we have examples of things that are called wellbeing frameworks that don't have any measurement components whatsoever. So for example, the Treasury's wellbeing framework, previously. But I guess one of the questions that we wanted to think about in defining the scope for our research is what makes a wellbeing approach to government or to policy or, to public bodies, different to just saying, we've got these different departments and they're already working on features of wellbeing, right? So the health department's working on health and social services are working on social services. What do you need that isn't already there if you're taking a wellbeing approach? And these were the features that we saw were kind of common to wellbeing frameworks, particularly as they moved beyond measurement or incorporated other factors. So one was that they were holistic. So obviously the determinants of wellbeing go well beyond the siloed structures where we usually tend to address them. To give a really obvious example, my health is not just going to be affected by things like whether or not I've got access to doctors, it's also going to be affected by my education level, the amount of pollution in my environment, my social connectedness and access to my community. A huge range of things determine what our health is. A huge range of things determine our equality of opportunity, our connectedness to others, our ability to engage in an environment that's going to be sustained over a long period of time. And holistic approaches are approaches that are trying to break down institutional silos and also potentially silos between jurisdictions as well. They take a long-term lens, so they're thinking about how to approach policy and other decision making beyond election cycles. So thinking in terms of decades, you need this long run up if you're actually going to genuinely turn around a system so that it's not only that you're treating the symptoms of acute need, but you're actually trying to reduce acute need in the first place. And that ties into the next feature, which is that they often take an upstream or early intervention lens. And actually early intervention is even too far downstream in some senses, right? So one of the problems that we have is that we have systems that are particularly focused on treating acute need after it has already arisen, rather than taking a step back and looking at the causes and the causes of those causes and the causes of those causes. I'm going to give an example that ties these together in a minute. And also that they're future focused. So they're not just thinking about current generations, they're thinking about future generations. They're thinking about ourselves, our children, our grandchildren, their grandchildren. And that's one of the reasons why when you see these international examples of wellbeing approaches, they have environmental wellbeing, environmental sustainability deeply at their core as well. So here's an example, not of a wellbeing framework, but of a wellbeing approach, which might illustrate some of the points that I've made, but you see they're going to come up again and again. So Scotland, and in particular Glasgow, has had a very terrible history with violent crime. In 2005, the UN released a report that identified Scotland as the most dangerous and violent country in the developed world. And in 2005, the city of Glasgow decided to take a different approach to knife crime. So rather than focusing on a law and order approach and increasing police capacity, they decided to treat it as a public health problem. They required police to work with health, education, and social work sectors, and they offered targeted help with housing, employment, and training to those who are identified to be most likely to offend, who are also most likely to be victims, right? So here we're seeing upstream, we're not treating the symptoms, we're trying to treat the causes, though of course, it'd be really valuable to go even further upstream and think, what are the causes of the kinds of poverty and inequality, particularly being condensed in certain areas that have kind of led to this, the problem and the need to bring in these social services interventions, these health interventions in the first place. They also took a long-term approach. So they approached this knowing that it was going to take a long time to work. And indeed, it took a decade to really show results, but those results were really incredible, right? So more than half, there was more than a halving of violent crime and emergency hospital admissions for assault within the first decade. This is a program that will have to run for a very, very long period of time if there's no structural change, but it's one that can continue its level of success because it is taking a wellbeing approach that has a long-term, upstream, future-focused lens to this particular issue. If I get time, but I probably won't, there's within the Victorian Treasury, there's a branch that's looking at early intervention investment frameworks where additional money can be provided for policy proposals that try to intervene early to prevent symptoms to prevent acute need, and they're partly assessed in terms of the amount of savings that you'll actually make over the long term if you intervene early. And the kinds of projected savings that these programs generate can then be invested back into this early intervention investment fund. There's a lot of really interesting work going in there. So the benefits of taking a wellbeing lens are, I mean, most importantly, moral benefits, democratic benefits, social benefits, but they can also be shown to be very, kind of obvious, no-nonsense economic and fiscal policy as well. All right, I'm not going to go through this in detail because I'm going to be talking about it, but the one thing we didn't have up the front of this paper that I would probably have put now in terms of some of the key features that are in wellbeing approaches is starting off with a shared vision. So we talk about this a little bit in the appendix, but I've become increasingly convinced that this is actually a necessary first step that isn't always taken by countries, but when it is, it's deeply important. So when I'm talking about a shared vision, I think about countries like Wales and Scotland, for example, which we saw in the previous talks, that have goals. They have goals, for example, Scotland has a goal that all children will grow up loved, right? What a wonderful goal. Wales has, a commitment of vision to be a more prosperous Wales, a more sustainable Wales, a more globally responsible Wales, coming together and thinking, what kind of country do we want to be? What kind of country would be proud to be? What kind of country do we want to raise our children, have our grandchildren thrive in? That's it's a really important part of this wellbeing journey, and it's one where you really do need engagement from the people. You need people to tell you what would make them proud, what are they excited about, what do they want to share with others, and what kind of vision do they have for the future that guides the kinds of wellbeing approaches that we want to see. The other ones, all right, measurement. I get to cut this a little bit shorter because of the fantastic presentations previously. One thing we said in the report was that measurement is a common first step. I think we were optimistic in framing it in that way. Measurement's often an only step, and obviously it's very important to have sources of data out there, and they can inform public debate and they can give momentum to a different way of thinking. But if all you do is measure, then you're not actually acting on the information that you're having. And if we're thinking about what makes a wellbeing framework a success, where there are actual changes in the way that we approach things and changes in outcomes for the people who live in a particular jurisdiction, then it definitely needs to be more than just measurement. It's worth saying there are lots of wellbeing measures out there and a lot of data, and it's really important not just to look at, say, national wellbeing frameworks or state wellbeing frameworks, but to augment them with all the incredible data sources that are out there that should be guiding our kinds of decision making, whether or not they're included in these frameworks. But it's worth, there are 2 points. I've got a nice one about measurement in the next slide, but 2 points of concern. One is it can be very tricky for wellbeing measures to drive policy. So, all of you people who work in wellbeing measurement will understand this, but I'm particularly thinking about national level wellbeing measures, right? And need to be relatively broad. And obviously there are a whole range of domains and indicators that they're going to be capturing. These don't change very quickly. If you look at something like life expectancy, right? Which is included in almost all of the wellbeing measures internationally. You can do incredible things to increase health and safety, which will eventually increase life expectancy. This is not something where you're going to see that dial move very fast over time. And you want to incentivize thoughtful, long-term, well-planned, systematic approaches that use resources sustainably. So thinking about just those kind of broader measurement, you may not see the dial move. And that's going to be very hard in terms of being a guide for policy, and particularly because it is also hard to attribute causation. So if you have policy change, is that the thing that led to movement in this dial? Where there are so many different factors that influence wellbeing outcomes that it's very hard to isolate those and say, well, this was the result of this particular policy. That said, sometimes measures do drive policy change. For example, in New Zealand, where the National Living Standards Framework sets certain policy priorities or identifies policy priorities in relation to areas of acute need. And there, we also have to be a little bit cautious, right? So it is true that it's great to have highlighted areas of need that we may have been unaware of through things like national wellbeing measures. However, we don't want this to result in a laser focus or a rigid commitment to improving the results of these specific indicators rather than thinking more broadly or more holistically. There are a couple of reasons for this. One is a political reason. If those dials don't, change very fast, right? And your main wellbeing commitments have been focused on increasing just those few indicators rather than taking an overall approach that'll have positive wellbeing benefits across the board, it's very hard to keep people enthusiastic about this project when it looks to them like there hasn't been significant change or even any change, even if this is happening slowly and we're going to see the results over a long period of time. There's another concern that this also can sometimes get in the way of a collaborative approach. So it can kind of build in or, feed on siloed natures of approaches. So Kate's presentation gave us really great vision for actually how you could focus on specific issues, taking a holistic wellbeing approach. But you have to be really careful that you don't say something like, okay, one of the things that we were going to solve was looking at, particular health, let's say mental health. And so this isn't relevant for, non-health departments, right? And you certainly don't want people to think that if you're spending money on, or you're putting your attention and focus on very, very important upstream interventions that may seem not to be relevant, but are actually key determinants of these indicators that you're trying to move, that you're not working to solve these problems. So for example, if we wanted to work on child poverty, we might need to think about things like changing labor laws, which don't look like they're directly in relation to child poverty, but actually affect things like family poverty, family ability to engage in other services, to upskill, to retain secure employment, that are going to have long-term effects on child poverty outcomes. But if you're not focusing specifically on the child end, it can sometimes look like you're not actually working on the problem when in fact you are. So you've got to be really careful even when you do use these measures to determine what kinds of policy interventions you're going to have. But pro measurement, if done well, wellbeing measures have an incredible potential to capture the public imagination, to spark debate, to increase political pressure, but also motivation to continue improvements and address regressions. And when I say if done well, there are some features of these measures which are more likely to determine whether or not they're done well. So being supported by investment in timely data, being able to be disaggregated by demographics and geography so that we can learn more about the whole range of diverse groups within a country rather than just having aggregated information. Recognition that there'll be data gaps and uncertainty, and making space for more indicators to be incorporated as available data improves. So in Iceland, for example, with their wellbeing measure, they've actually left columns or left gaps where new information can be added when measurements improve in particular areas, particularly certain environmental measures where they don't yet have either historical data or ways of measuring particular environmental impacts. And also, they're better when they're developed with the community as a partner, where community, even though we know this often ends up in a lot of overlap with, for example, the OECD domains, involving community as a partner gives the community ownership over particular approaches, and involving them democratically actually directly increases their well-being anyway. But also you get to find these nice nuggets, right? So in Iceland, one of the things that the community was asked to do was to rank some of the well-being domains, well-being indicators, and in particular with a focus on what things were particularly important to them but that weren't being fulfilled. And, there are a number of things that you would expect to come up, such as housing, but one of the absolute top ones, particularly for young people in Iceland, was work-life balance. That kind of information wouldn't necessarily come through if you were stepping back thinking, all right, what is it that's most important to affecting people's overall well-being? But you also get these opportunities for this kind of wonderful national picture, right? So in New Zealand, not that this one particularly came out of community consultation, but rather that, you know, you get these, you get a chance to get an insight into national character. So one of the New Zealand indicators is water quality, brackets, swimmability. Now that seems to me to be a very New Zealand and possibly quite an Australian indicator of well-being and environmental dimensions of well-being that you might be less likely to find in somewhere like landlocked Bhutan, right? In Wales, Welsh culture and language is a really important part of the Welsh well-being approach. And in Scotland, even though I've mentioned it before, I just absolutely love it. The idea that every child would grow up being loved is part of the Scottish approach. Okay, policy analysis and selection, and I have to be relatively quick. There are a whole range of different ways in which well-being can be embedded in policy analysis and selection. I'm just going to give 2 examples because they're going to tie into the kind of overarching points I'm going to make at the end. So the first one is expert panels. Bhutan has this. So when there are policy proposals, a panel of experts looks at them and ranks them in terms of whether or not they are likely to increase or decrease gross national happiness by a certain amount. Those that are most likely to fail to increase gross national happiness or actually likely to reduce it aren't able to get through to the next stage of policy analysis and selection. And one thing that's really important when thinking about how to embed well-being into policy selection structures is we're not just thinking about choosing the good policies, right? We're not just thinking about where to direct our money or where to direct our focus, but also what is already out there, what's existing that is actually going to harm well-being, where we're going to have to spend huge amounts of resource on cleaning up the damage that has been done by putting certain things in place. And having that kind of analysis allows us to stop these things from going through before they even, get past the gateway. Cost benefit analysis. This is a really nice example to, show a point that I'm going to bring up later, but it's about clarity and being clear and helpful in terms of showing people how to do things. And that's people particularly who are working in the public service. So in the UK, the UK's Green Book, which is the guide to cost benefit analysis, there is a guide on how you can include well-being measures within cost benefit analysis in the UK. However, anecdotally, this isn't really used. It's not used because people are very used to using the system that's already in place, and it's not easy to use. It's not easy to use in part because even though you've got a guide to how to do well-being measures, you don't have weighting. And of course, you don't have weighting because the people who wrote up this book thought, who are we to say which should be weighted more heavily, right? Health or education or security. But what happens is you're passing that job down the line to the next person who already knows how to do traditional cost benefit analysis and is now in a position where they've not only got to add this extra thing, but they've got to work out this deep, ethical question, right? About how you weight these different components every single time they do these cost benefit analysis that have these well-being measures incorporated, right? So of course that's going to put people off, and of course that's going to be really problematic. In comparison, in New Zealand, they have CBAX, which is a form of cost benefit analysis that has well-being measures as a component, and these are pre-weighted. It's essentially filling out an Excel spreadsheet, but where you have all the dimensions already there. The uptake in New Zealand has been much greater than the uptake in the UK, and there's some data that suggests that this has led to more effective overall cost benefit analysis decision-making. But it's not just about, this is going to be my love letter to Wales in a sec, I'm sure we'll all have them. It's not just about how you weigh up the existing policies that have been brought before you. The other thing, or at least one of the many things that's really important, is how do we make sure that we're actually coming up with the kinds of policies that are innovative, that are original, that actually respond to demand, that think outside of the box, so that we get change that is a kind of, it's It's a deeper, more embedded well-being approach change rather than just thinking with the tools that we've already got. And the wonderful thing about the Welsh example is that they've done a really good job of this. So the Welsh Future Generations or Wellbeing of Future Generations Act says that every public body, from ministers to departments down to all other public bodies that are within the jurisdiction, that's sports organisations, national parks and hospitals and cultural organisations, must work towards the 7 Welsh wellbeing goals that are here on the left, but actually have quite a bit more detail in them. And that they must report on what they're doing to get to move towards these goals. And then they've got guidance for how you'd think about working towards these goals. They've got these 5 ways of working. And if you look at them, they map on pretty well with the defining features of a wellbeing approach, right? Long-term, prevention, upstream, integration, breaking down silos, being holistic, collaboration, community involvement. So we've got ways of working, we've got a guide for how we're going to get there. We've got a thing that we're all working towards, national vision. We've got the fact that you have to regularly report. And then in addition to that, you also have to make these goals guide all of your decision-making, not just policy decision-making about procurement, about HR, about how you use your land. And we've seen fantastic results from this. So for example, hospitals are now thinking about how they would use hospital grounds to make gardens where there are community spaces where patients and community can come together. They're thinking about where they get their food supplies from. Is it, can they get it locally? Can they support local farmers? Apparently most hospitals in Wales now have beehives on the roofs to help support biodiversity and sustainability. And, in thinking about in terms of collaboration, one example, Cardiff Department of Public Transport, using this approach, decided that they were going to second a public health official, Department of Transport, not just public transport, second a health official to help them come up with a new public transport or new transport approach for the city of Cardiff, right? So in using this collaboration and using this shared knowledge, breaking down these silos, they ended up coming up with an approach where prior to this, 2/3 of their budget had been spent on roads, and now less than 1/3 of their budget was spent on roads. They put in a lot more money into active transport and into public transport. They looked at the equity and equality effects of this. So the people who were most likely to be affected by pollution and lack of access of active transport were also those most likely to be poor, living in low socioeconomic areas and being Black and minority ethnic populations. And so this approach was seen not just as important environmentally and in terms of health, but also in addressing some of those inequality issues, particularly because these groups are the groups least likely to own cars, so least likely to benefit from the roads focused transport system. And then this got brought back to the Department of Health with the public health expert moving back, and health policy change. So now in Cardiff, you can get bicycles prescribed on the NHS, right? There's incredible things can come when you've got a clear guidance for how you're actually working together and that this is embedded across the system. All right, talking about embedding, and I'll make this short, there are lots of ways in which you can embed wellbeing approaches in government and other public body systems. And some of those are going to include things like different tools. It's going to include training. Culture change is deeply important. We're not talking about doing the same thing, but just with a little tweak. We're not talking about just sending more money to particular departments. We're talking about changing the way in which you see the problems and respond to those problems and think about those problems and carry out your everyday activities. And you need supportive culture change. You need to make sure that training happens at all levels. So in Scotland, training is not just given to the people on the ground, but people in high up managerial positions. I'm sure we'll hear from the ACT soon that one of the great successes with ACT culture change was having leaders who told people that they probably weren't going to get it exactly right the first time round, but that they should keep trying and keep focusing on this, and giving them room to make mistakes while also supporting those kinds of wins, making it clear and easy. So the Victorian Early Intervention Investment Framework, one of the things that I heard about this, which I love, is you get departments that want to put in bids for policy proposals that are going to have, potentially fantastic effects because they're intervening really early. But because this is slightly different to a regular bid system, in addition, they just need to fill out this extra spreadsheet. Part of it, half of it, is filling out the kinds of wellbeing outcomes that will come from this early intervention, right? And those departments are often really well positioned to know what those outcomes are going to be. The other half is projecting this in terms of costs, including thinking about projected future costs. And often departments are going to find that much harder. But so this team within the Victorian Treasury decided that they were going to build up their own skills and expertise so that they would spend their time working with departments who are putting in bids to fill out this other part of the form. They became the experts. And so, talk about making it easy. They do it for them, right? But of course, this is what you want. You want a system where it's not difficult to do the right thing. It just becomes embedded in operations. One of the nice things about embedded change, even though it can be tricky to implement, means that you're so much more likely to get longevity. And so I talked to people in New Zealand about their fears in relation to what a potential change of government could mean, for example, for their wellbeing approaches. And one of the things that comes up is that the living standards framework is so deeply embedded and kind of arose somewhat separately from the political process, that's likely to stick around even if overall commitment to wellbeing approaches goes. You look at the Australian Treasury framework and people say it was scrapped, and it was in one sense, but this was a guide to decision making, a guide to what to think about when you analyse policy in the Australian Federal Treasury. And from everything that I've heard, that's stuck around. It's stuck around in people's minds because it's become part of the institutional inertia. It might not be the thing that they directly look at, but it completely changed the practice within the Australian Treasury. All right. Accountability and transparency. So this is another thing that we see in wellbeing frameworks. There are a couple of aspects to this, but obviously there's too much to talk about. So I'm just going to talk about the middle one, independent oversight and scrutiny. Here is my, I tried to find an illustration that had carrots and sticks in it, but this one looked nicer, so it's not particularly relevant. But I'm going to adopt this old-fashioned analogy of carrots and sticks. If you want there to be change, real change, sure, sometimes you need systems that allow you to identify where this isn't happening and to motivate people to change where it's not happening. But if you want your buggy to move forward, you can't just use carrots and sticks. You need a driver who's knowing where they're going, and you need to make sure that the road is fit for purpose and there aren't blocks in the way, right? Otherwise, it's just very hard to bring about these kinds of change. So I'm an absolute optimist, which is very irritating to some people, but I really actually think that most people in politics and in the public service genuinely want to improve well-being, right? They're not twisting their mustaches. People really care about well-being. We just have different ideas about how we're going to get there or what you can do, what needs to be done to improve well-being. And I think that actually providing support is one of the best ways of keeping up accountability and transparency. So the Welsh Future Generations Commissioner has a role where she is able to audit any public bodies and see whether or not they're working towards meeting those wellbeing goals. She then gives recommendations if she thinks that they're not working towards meeting their wellbeing goals about what they should actually do, right? This is support, this is guidance. It's not just telling people off. They don't have to comply, but if they don't, they need to justify, which is a great motivator for getting people to do things. It's just making it very slightly difficult for them not to do things. This is why we all vote, right? Partly because we're civically engaged and partly because it's really annoying to fill out one of those forms explaining why you didn't vote, even though it's incredibly simple, right? So having this kind of support mechanism that actually shows people how you get there, where it is that you're supposed to be going and what it is that you need to do has been so successful in Wales that apparently private companies are now going to the Future Generation Commissioner's office and asking that office to assist them in working towards the Welsh Wellbeing Goals as well, which I think is very significant. All right, time. But the other thing, just a caveat, is we also actually need to be aware of who has power. So in Scotland, incredible system, but it hasn't worked as well as people there would have liked to have seen. And in talking to people there, one of the real problems is that vested interests in Scotland still have a disproportionate amount of power over what's going on politically there, what's going on within departments. Okay, I'm going to leave this with you, but very quickly, here are the success factors that we kind of identified in our research. And of course, they're not guaranteed success factors, but they're the things that were more common to the kinds of approaches that seem to be leading to systematic change, and we're beginning to show some positive outcomes. Being ambitious, moving, measurement, great, but very much moving beyond those. And the greater levels of ambition, so for places like Bhutan and Wales, seem to really be followed by greater change moving in a positive direction. And of course, that ties into changing how the economy and policy making operates. Having an agreed vision and practical guidance on how to get there. I can't stress enough how important it is to just make sure that people know what it is that they need to be doing. And that requires smart people thinking really hard, working with those people who are actually going to be making these decisions, implementing things on the ground to work out how you create a system that supports and enables people to be working towards wellbeing goals. Accountability guardrails are important. We need to identify where people aren't making an effort or where their efforts aren't being successful, but also alongside support and community and consultation and design. You need to bring the people along with you. That's essential for legitimacy and longevity. I'll leave it there. Thank you.